second speaker on the panel. That's Professor Gopi Krishna from India. He is a founder director of Root Canal Foundation based in Chennai in India. He completed his PhD in the field of endodontics from the Dr. MGR Educational and Research Institute University in the year 2017. He is the editor-in-chief of Endodontology Journal and the associate editor of the European Endodontic Journal. He is also the general secretary and the clinical examiner for the Indian Board of Endodontics, a very renowned endodontist who is an editor of 6 textbooks, including the acclaimed Grossman's Endodontic Practice. I request Dr. Gopi Krishna to share his views.
Thank you. Thank you for the kind invite. And it was a pleasure listening to Dr. Irfan from Pakistan and for him to share his views. And I will take things further ahead. And it's a wonderful platform of various clinicians across South Asia to get together to present our views. So I would be taking things ahead from where Dr. Irfan has told us about. The first insight which I would like all of us, the viewers who are sitting in South Asia, to see is currently today, worldwide, there are 3 huge clusters of these cases. So yes, 2 points. First, take home, there are no dental clusters. Dentistry has not been recognized as a cluster for transmitting cases. So dental practices are not going to cause transmission. So that's the good news. But the bad news is your patients can bring the disease to you. Why? Because you and I live in the 3rd largest cluster of cases on earth. So simple mathematics, the probability of a patient coming to a practice who is asymptomatic and probably transmitting it to us is more than we as dentists transmitting the disease from our practice to others. So you need to obviously to ensure that as far as possible that there is some amount of triaging. Right now, for the last 2 months in India, we are practicing full-blown. Even I'm going to my practice every single day, and I am seeing 6 to 7 endodontic procedures. And me and our team are safe. But we do one thing. We always make sure we speak to the patient. We do the 3 A's. We advise the patients what is the problem. We make sure that we space the appointments and we call them only when there is a requirement. So we are planning our schedule much more meticulously than before. The most important point when a patient enters your practice is to consider every patient as a carrier. I simply assume that everyone is a carrier. The only thing is they might be asymptomatic. Like Dr. Qureshi showed, we also do pulse oximetry, we take the temperature, all. But the point is, most of these patients who are transmitting the diseases might not have these symptoms. So that's the challenge we would have. So the most important solution for that is to have certain kind of practices in your clinical work, wherein you can ensure that the patient is not bringing an infection and transmitting to us. To me, my take-home point from my presentation is this. We need to protect ourselves. We are not the transmitters, but we need to protect ourselves and our team and not end up as transmitters. So hence, spacing of appointments and avoiding the strict no-no for walking patients is the most important. The other aspect I was asked to discuss in this short 5-minute lecture, which I'm supposed to give, is on the importance of COVID testing. Right now in India, there was a huge emphasis on doing the more commercially easily available antibody testing, which is what everybody likes to do. It's very economical. You get the result within an hour. But to be frank, it has got a very high false negativity. Hence, I would say that this is the test which is there, which is more useful for now. The understanding is to find out if you had a history of COVID, it's more useful for that, but not for the diagnosis of having COVID. So the test which we need is RT-PCR, which is now the standard gold test. Even that, the false positive rates are up to 20 to 25%. Hence, I'm just giving you one single sheet. If you go to this website, I think this is the most updated sheet. If you want to know more about testing, you just go to this website and you get what is the guidance. Simply put, antibody testing is only done if you want to find out the history of whether you had COVID infection, just to get to know whether your antibodies are there or you are still infected in your history past. But for you and me as clinicians or people who are going to do, I think if you want to test anybody, you need to do the viral testing, which is the RT-PCR. Current recommendation, only 2 times you need to test. Anybody who's symptomatic, who comes to you or whom you know and you're worried, you need to get them tested. And asymptomatic is all healthcare workers. If you are or anybody in your team is getting symptoms of cough or cold or fever, I think the whole team has to get RT-PCR. So you can set a protocol. I would not go to the extent of testing myself every 2 weeks. I have not done that. But yes, if there is a person in the team who's getting symptoms, I think it's prudent for a practice to get all of them tested periodically. Coming to the core area where I was supposed to talk was on aerosols, and we create aerosols. Dentistry is aerosols. So without aerosols, there is nothing we can do. And that's the reason why WHO and everybody panicked, that because of dentistry, we might be disease transmitters. But you know what? Barber shops, vegetable vendors, and all malls, cinemas, all religious congregations, that's been the disease generator and transmitter areas, and not dental clinics. So the key point for you and me to understand is I am been using aerosols. As an endodontist, I cannot work without aerosols. I think endodontists and prosthodontists cannot, and periodontists too, we cannot do any procedure without creating aerosol. So as I would say is, yes, so we would be creating aerosols. And what is the problem with the aerosol is the size of these viruses are so small that along with these aerosols, they can stay in our dental operatory for much more time. So you can put on your rubber dam, you can do many things, but before that, if there is aerosol which is generated, this aerosol in your closed room can cause a problem. And that is the where I'm coming to. I have a nice swanky practice in Chennai. Everybody raves about it. We are very highly rated. I have a huge space. But what about the common dental clinic in South Asia? In Bangladesh, in India, in Pakistan, 90% of clinics are one-room clinics. There is something like this. This is not my operatory, but a clinic with 2 rooms, 2 chairs outside, very close space, and inside you have 1 chair, everything is enclosed. You have an air conditioner which runs all the time, and you are breathing the same air again and again. So the problem of if you are going to get infected is because of the air which we are going to breathe. The dentist, I feel, is the one who is at risk and not the patient when it comes to COVID in this era. So the only way you can do is to understand how you can improve your air circulation, which is what we focused on in India. I was in charge of creating this SOP for our society and as well as for the international body of endodontic associations. And what we recommended more than 3 months back is what the whole world is now recommending, that you need to improve airflow circulation. More than anything else, the air in your room, there are only 2 things where you can get infected. One is by touch or when the patient coughs on your face, which we are protected because of our PPE. But what about the air which we are breathing, what the patient is breathing? Hence, if you have a clinic, no matter big, small, or what, and if you are like anybody else in Asia, South Asia, you cannot practice without an air conditioner. So for people who do not have air conditioners or who have got clinics which cannot afford HEPA filters, then the only choice is to have pedestal fans and exhaust fans so that you can suck in air out of your clinics and do. This is a solution which looks very simple, but that is the only solution you have if you cannot invest on something which can improve the air quality in your room, is my 2 cents. So like anybody else, you need to have a dental protection unit. Instead of a PPE, I would say a dental protection unit, a DPE, which is more about your face. And it basically is the face shield. In the limited knowledge we have, I personally think the #1 protection for us is the face shield which we are going to use. That's very important. And then obviously comes the masks which you're wearing, N95s, or you can also use the industrial respirators, one of the 2. There are other reports to say again, which is coming in more and more, which says that changing the mask and making sure the face shield is there to prevent the splatter to hit you, because the virus is either going to come through contact through the splatter or through the air which we are going to breathe. And this is what we do. So this is what I work. So I have a HEPA medical grade air purifier in every operatory. So when we work, the air is getting 12 air changes per hour. That's the purview which we would recommend. And then you can go about, do your work, sterilize everything, and then go about. And this is what I've been doing day in and day out for the last 2 months. So take home points in this quick 5 minutes is this: 3 points. Testing strategies is need-based. I would not say it's empirical. I would not recommend it as a routine practice. I would only say do it as need-based. Triage your patients and plan your appointments more meticulously. If you are like any good practice planned well, I think if you're planned well, I'm seeing my workflow improving every day, every week as I go back to practice. The only thing which is different is obviously an added layer of protections which we are putting. And I think that's good for you and me in this era. Lastly, aerosol generating procedures, which is what everybody is worried about, is absolutely safe, and you can go ahead and do it. And I do not see, as of now, in the whole of the world, in Korea to Japan to into all the parts of Europe and US, there is no report of aerosol generating procedures in dentistry causing any kinds of transmission. So I think dentistry is safe with extra precautions. I think our future is bright as ever. I thank you all for this wonderful opportunity, and I would be ready to take some questions right now, Puneet. Thank you.
Thank you, Dr. Gopi. It was wonderful how you summarized how to tele-triage your patients and how to make a protocol for testing. In fact, the first question which we have for you is on testing strategies. The question is that what is your flow chart of which patients should you get tested and which patients should not be?
I would see the question of testing is basically in dentistry, to be perfectly, if you ask me, I would only recommend for patients who have had a history of travel, and now there is absolute travel ban. So if you ask me, the whole question in dentistry, it's a personal take. Now, if you can ask, would I put all my patients under testing? The answer is no. I simply do not allow them to come into my practice if I know if they had a history of a fever or anything which could be there. Because now we realize that 75 to 80% of your patients would be asymptomatic. And these asymptomatic patients cannot transmit the enough viral load to you in that 45 minutes of period if you take the due precautions. So it's like me asking you a question, do you test for HIV for every case? Do you test for hepatitis for every case? The answer is no, you do not. You take more precautions. So there are two ways of looking at this question. A, test everybody and bring in only those people who are going to be negative. This strategy is useful for a country where they are going to have immigration controls. So you travel from A country to B, now they have putting you that you need to get a negative and come inside. But whereas for a dental practice, I would say, unless if you want to do testing, then the only way is to do an RT-PCR. And to get a RT-PCR for every single patient, I don't think it's practically feasible in South Asia. So there are two ways of answering this. One is an academic way and one is a clinical way. So I would rather say set the protocols, keep yourself safe, and then I think periodically testing yourself and your staff, if anybody in the team, it's very important. If you look at the CDC guideline, they are very clearly saying specifically, test the team if anybody in the team has a history of symptoms, is more practical and sensible. And this is what the US CDC is giving us. And I think that's a fair enough recommendation for all of us to follow.
I think you very perfectly summarized whether to go for testing or not. The second question, very short one for you, is that are there some, we are talking about tele-dentistry. Are there some, is there some law in South Asia regarding tele-dentistry, or we are still evolving?
I would say there's no specific law, but right now the one important improvement, at least in India, is that you are allowed to give prescriptions or through tele-dentistry or by WhatsApp, or you can image and do. Earlier, you need to give a physical prescription, and then only the pharmacist was allowed to give you, and that's there. But I see there's a huge scope of tele-dentistry, and I think many softwares have already evolved. And even today morning, I had a couple of patients who are sending me or doing a video call and talking to me. And it actually, if you keep a couple of people in your practice, couple of my dentists in my practice are slotted for this. So what it does is they are doing the basic consultation, which you would normally do when the patient comes to you and talks. So the talking time between you and the patient is reduced if you strongly follow tele-dentistry. So that really makes the time less for you to talk. And talking to the patient with your N95 and respirators is a huge ask. If you ask me which is the toughest thing to do, is to talk to patients when you do the procedure. So I personally don't like doing that when I'm wearing this, because you will feel exhausted when you are trying to talk with the respirators on. So tele-dentistry is fantastic in not only filtering your patients, but also trying to get the other intricacies and information that you would need before they walk into your practice.
Thank you so much, Dr. Gopi. We will get in touch with you as soon as the panel discussion starts.
Yep.
Thank you so much.
Absolute pleasure. Thank you.